First of all, for Sandra, did you get any pushback on the multi-hour training? And this person comments that our institution staff would be expected to content to be delivered in an hour or perhaps three.
Um, so we were worried with the in-person workshop that it would be difficult for students and faculty to carve that time out. So moving online, I think because the modules are accredited individually, you don't even have to complete the whole series to start getting your credits. So for faculty who are busy, their schedules change, they can essentially go online and they can move through those modules as they have time. And so each of those modules is meant to be about 30 to 45 minutes of reading. Cochrane Interactive Learning modules, they range from 45 minutes to 2 hours. So we feel like ours are obviously like the much lighter version. And so we know that residents, faculty, physicians are having to do CPD, so giving them options where they can have these digestible bits, not necessarily have to do all, 8 modules, all potentially, 4 hours. It gives them more flexibility.
Thank you, Sandra. Christina, a question for you. Can any type of evidence synthesis be submitted to Protocol Archive, even scoping reviews?
Yes, we have a lot of scoping reviews. In fact, in the ones that have been deposited to date. Absolutely.
Great. Back to Sandra. Let's see. Do the training modules meet WCAG 2.1 accessibility standards?
I would love to actually have them assessed for that because I know in working with our Office for Professional Development with the Director of Lifelong Learning, we had conversations throughout about how to make the content accessible through Articulate Rise. And I mentioned some of the sort of simple ways of doing that when thinking about universal design and diverse learners and technologies. So it might just be nice to actually have it like peer reviewed or assessed to just get a stamp, of how well it is doing for accessibility. I hope it's doing well, but if there's a way to actually know and then potentially with updates to address any of those issues.
Thank you. Christina, someone asked, the protocols in Protocol Archive, are they discoverable anywhere else, such as Google Scholar?
Yes, everything on the CABI digital library is indexed by Google Scholar for discoverability. And yeah, we get a lot of traffic that way. Yeah.
And Sandra, there's a question about maybe you could talk about what you think it would entail to take the modules you've created and tailor them for a non-health sciences research audience, and how much work you think that would take, or what a good approach might be.
Yeah, I think some of the modules would be more easy, if you will, to sort of repurpose. Introduction to systematic reviews, for example. When it comes to searching for eligible studies, a lot of the focus is presenting health sciences databases, but we talk about things like what is great literature as well. So unfortunately, I think it would require a lot of edits probably to get it to a place where it's catered to non-health sciences. But like we have mentioned, or one of those testimonials pointed out, we have people from other disciplines outside of the health sciences that also are reviewing these modules and give us feedback and attend our workshops that are based on the modules and still find it useful. But I think if you wanted to do a quicker version, you don't have to make it as exhaustive in terms of, flipping everything out. But I think that there are some ways that, you could make it a lot of work or a little work just to find a way to cater it more to the non-health sciences researchers.
Thank you so much. And I'm going to try and combine two questions for you, Christina. Um, one about the findability of the protocol archive index protocols in other CABI databases, specifically CAB abstracts
Yeah,
and vet med
global health.
resource,
Yeah.
global health. Yeah. And
Yeah, but I mean, it's because we index it with our so-called CABI codes, which are very broad subject area codes. So that's how it, it's assigned to the subject database that the correct subject base. So we cover. I mean, we have 46 different subject bases, databases, including, of course, CAB abstracts and global health. So yeah.
excellent. And also for you, Christina, could you add some more detail about whether existing protocols are being mined from those other repositories and
They
pointed to?
are. They're being, I didn't really go into that too much because that would have taken another 10 minutes. But yes, we mine a variety of sources. We also mine some journal literature, but we also mine gray literature and areas and yeah, repositories. I mean, if you would like any repositories, to bring to our attention, we'd be delighted to hear about that, and to index the content. Yeah, so very happy to hear about that.
Okay, excellent. And I think that brings us to the end of our session. So thank you to both of our excellent presenters. Really enjoyable talks, and thank you so much.